mynews.studio.
In the Amazon rainforest, Suriname, a country once battling malaria, has now eliminated the disease entirely. How did they manage this? And what could it mean for their neighbors?
Today is July 8th, 2025. Suriname has become the first nation in the Amazon to be officially certified malaria-free by the World Health Organization. This isn't just a number. It's a transformation that's taken nearly 70 years. Can you explain why getting rid of malaria in Suriname was such a challenge compared to other places?
The biggest hurdle was geography. Suriname's interior is dense rainforest, and the people living there, like gold miners and indigenous communities, move around a lot. Traditional health systems just don't reach these areas easily. Back in the early 2000s, some regions were seeing as many as 160 cases per 1,000 people every year. That's a huge burden for any health service.
What changed? Was it just about better medicine, or did they rethink how care was delivered?
It was a combination, but the real shift was in how they involved communities. In the 1970s, Suriname started training community health workers from inside indigenous and tribal groups. These workers could diagnose malaria right there, treat it quickly, and most importantly, people trusted them.
So not high-tech solutions, but more about having people on the ground?
Exactly. They did use rapid diagnostic tests and expanded access to microscopy, but the real innovation was embedding people in every community. They also handed out insecticide-treated bed nets and sent mobile teams to reach remote camps and settlements.
How did they keep track of cases? Malaria can flare up so fast.
Surveillance was crucial. They regularly collected blood smears and reported data in real time. That allowed them to spot outbreaks fast and contain them. They didn't just treat patients. They monitored every case, mapping transmission in different ecological zones: the coast, savanna, and forest.
Were there partnerships across borders, since the Amazon doesn't stop at national lines?
Yes, definitely. Suriname worked with Brazil, Guyana, and French Guiana on cross-border surveillance and joint interventions. People move constantly in this region, so collaboration was essential to keep malaria from coming back.
Was this mainly a local effort, or did international partners play a big role too?
It was both. Suriname's government set up a national malaria elimination task force and a dedicated fund, but international partners were vital too, like the Global Fund, PAHO, WHO, and support from the US. Sustained commitment at every level really made the difference.
When did Suriname see its last malaria cases?
The last Plasmodium falciparum case was in 2018. The last P. vivax case was in 2021. They've now had 0 indigenous cases for over 3 years, which meets WHO's criteria for certification.
What comes next? Can neighboring countries follow Suriname's example?
Brazil, Guyana, and French Guiana are all studying Suriname's model, especially the use of community health workers and targeted surveillance. But there are obstacles. Funding is tight, the region is vast, and political instability can slow progress. There's also an ongoing risk of drug and insecticide resistance.
Is there a risk malaria could return, especially with climate change and people moving across borders?
Yes, that's a real risk. Constant vigilance is needed. Suriname has to keep strong surveillance and rapid response systems in place. Imported cases from neighbors are still a threat, and climate change could shift mosquito habitats.
Are any new tools on the horizon that could help Suriname stay malaria-free or help other countries?
Newer bed nets and malaria vaccines could help. For Suriname, these could offer extra protection, especially against imported cases. Across the Amazon, these tools might reach groups that current methods miss, but only if health systems stay strong and funding doesn't falter.
Why should people outside the tropics care about this? Isn't malaria mostly a problem in certain regions?
Malaria still kills hundreds of thousands every year, mostly children. What Suriname achieved shows elimination is possible even in hard-to-reach, low-resource settings. It's proof that similar strategies could work elsewhere in the fight against infectious diseases.
If Suriname managed this despite tough terrain and limited resources, what's holding other countries back?
It's about political will, community involvement, adapting strategies, and working across borders. Suriname's story is a guide, but each country will need to tailor it to its own situation.
Suriname's malaria-free status is a milestone, but it's also a reminder. Vigilance, innovation, and partnership are still essential.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now, free of charge.